Going over CPR. Now, later in the year, we'll hopefully be able to use mannequins, but at this point, we're just going to talk about it and go through all the steps and know how to do it, at least through our minds, and then we can practice it in person later. So, chain of survival. The concept is early access with early CPR and early defibrillation allows more positive outcomes. So, the faster you get help, the more likely you'll survive. So, chain of survival, step 1. Always, always, always determine the scene is safe. You need to say it verbally. Always, scene is safe. Step 1, always, scene is safe. After determining that there's an injury that's needed, you want to tap them. Someone that's unconscious, tap and shout. Tap and shout, are you okay? Are you okay? Then you call 911. When you call 911, you need to tell them what's happening, where you are, who's hurt, how they're hurt, what you've started, and only hang up if they tell you to hang up. Step 2, you're going to begin CPR. In a little bit, we'll go over the exact steps, but the reason why we do this is most cardiac arrests in adults happen with ventricular fibrillation or VFib. This is basically a chaotic heart rhythm, so there's still a rhythm, so you want to try to get that rhythm back normalized. CPR won't stop the VF, but it can help oxygenated blood throughout. The AED is what shocks it back into rhythm and gets it going in the correct rhythm. CPR can double or triple the survival rate, so it's incredibly important. And notice with CPR, there's only a 3 to 4% drop each minute compared to 7 to 10. So then you want to use an AED. An AED is the automated external defibrillator. Some people call it the shocker thing. It basically is what shocks the heart back into normal rhythm. And if you use it within 5 minutes, your chance of survival increased to 49 to 75%. It's a super simple thing. Honestly, a kid could use it, a monkey could use it. It verbally tells you the directions as well as there's pictures. So don't be afraid to use it. If you see it, get it. And then advanced care is when EMS. So realize EMS on average takes 7 to 8 minutes. So you need to be doing CPR in those 7 to 8 minutes. Otherwise, the likelihood of survival is very, very low. So how do we know it's a major emergency and we need to perform this? Step 1 or option 1 is a heart attack or myocardial infarction. Basically, it's heart disease, heart attack. We've all kind of heard of a heart attack. It's a blockage of an artery within the heart muscle. So it prevents the heart from being able to contract. They're typically awake and can talk but have severe pain or are incoherent. Most critical times within that first 30 minutes after symptom begins. Most common symptoms are pain in the center of the chest, pressure or feeling like someone's sitting on your chest. Pain can spread down the shoulder, typically the right shoulder and arm or lower jaw. You can have pain in your back as well, but most of the time it's pain in your chest. Sometimes it'll stop and start. Normally there's a lot of sweating or shortness of breath. So most victims are going to downplay the symptoms. So you want to make sure that you take the symptoms seriously. When the heart stops beating, it's usually caused by this because the heart muscle is injured. Without the blood flow, there can be no pulse, and therefore you stop breathing and you become unconscious. And so we want to add an AED as quickly as possible. Stroke. So stroke is when there is basically a blockage in an artery in one of the arteries of the brain. So blood vessel is blocked, so the blood can't get to the brain. Okay, or the blood vessel in the brain breaks. And it's a very common thing that happens. Sometimes you see a facial droop, arm weakness, or suddenly they'll start jittering or being unable to talk. So you want to call 911 immediately. Foreign body obstruction or choking, traditionally caused by food. Major signs, universal choking sign, grabbing your throat, ineffective coughing, inability to speak, wheezing, or like a high-pitched whistle. Then we start having difficulty breathing or blue lips. You want to start with the Heimlich maneuver. If that does not work or they become unconscious, then you go into CPR. So, specifically, CPR for an adult. Step 1, approach the victim. Check the scene is safe. Check responsiveness. Tap and shout, tap and shout. Are you okay? Are you okay? No response. call 911 or send someone to call. If you're by yourself, you need to call first. If you are not by yourself, send someone to call and you begin CPR. If there is someone present, send them to get the AED. If there's no one present and you are by yourself, go and call 911 and get the AED at the same time. When you're telling someone to go do something, use very descriptive words and use their names. Johnny, go get the AED. Mary, call 911. If you just say, hey, someone do this, no one's going to do it because they think someone else is going to do it. Step 2, you want to make sure the victim is supine, so laying on their back on a hard surface if possible. You don't want them on a couch or a bed. You want to move them to the floor. If they're prone or laying on their stomach, roll them over to their back. Be aware of their neck if that's a possible injury. Then you want to remember your ABCs, so airway, breathing, circulation. Airway, head tilt, chin lift. So you want to check their airway. So you want to push down their head by their forehead and pull up at their chin. It's a head tilt, chin lift. This opens the airway. You can see in that diagram, and you guys even know when you're sitting there, if you tuck your chin down to your chest, it's harder for you to breathe than if you lift your chin up and back. B, breathing. Look, listen, feel for breathing, no more than 10 seconds. If no breathing, give 2 rescue breaths, and then see if the chest rises. Then circulation. If not breathing, begin chest compression. You don't need to check for pulse. If they're not breathing, assume they don't have a pulse. Just go straight to CPR. Okay, so make sure when you put your palms on their chest, you interlock your hands like the image shows, and you want to make sure the heel of your hand is in the center of the chest, not your fingers, not the balls of your hand or the knuckles of your hand. The heel of your hand is in the middle of the chest because all your force is going to go through that. You want to make sure you're on your knees and you're up off your heels and you're straight over, because that way you'll push straight down into the victim instead of at a slant. You see in that first picture, the woman is directly over the victim. In the second picture, she's slanted. Okay, so you want to make sure that you are in the correct position. And then you're going to press down, and you're going to press down at least 2 inches at a rate of 100 beats per minute. It's hard and fast, okay? You want to go hard as fast as you can. It's 2 minutes. You're probably going to have some rib cracking. That's okay. That means you're doing it correctly. Continue to go that deep. 2 inches is deeper than you think. Now you also want to let the chest recoil. So push down 2 inches and allow the chest to completely back up and then back down. You want to complete 30 compressions and then 2 breaths. Do not stop these compressions unless EMS tells you to, or if you're switching cycles with another rescuer to reduce fatigue, or an AED becomes available and they attach it. So interlock your hands between the nipples in the center of the chest, at least 2 inches. It's 30 to 2, 100 beats per minute, and you want to switch at 5 cycles, so 2 minutes. So hands-only CPR is when you don't use your rescue breaths, and that's okay too. CPR is better than no CPR, and there is oxygen in your bloodstream, so it will still help the victim. So here's steps. Tap and shout. Go get help. Look for breathing. Push hard, push fast. 2 rescue breaths. 30 to 2. 30 to 2, put the AED on. Also, you don't want to interrupt your compressions. So if someone arrives with the AED, you continue to do CPR while they put the AED on around you. Okay, and when you give breaths, make sure they're not too forceful or too big. You just want the chest to rise. It's more likely to cause vomiting if you give them too much air. Vomiting might happen and probably will happen if you're doing rescue breaths. That is why we recommend a mask or a face shield. Not what we know as face shields now, but CPR face shields, and that way it prevents transfer of bodily fluids. If they start breathing, then you can roll them over into the recovery position, basically laying on their side to make sure if they vomit or anything else, they're ready. If there is a potential neck injury, you want one person to be stabilizing the neck and the other person to be in charge of CPR. So stabilizing the neck is significant and needed, okay? However, you also need CPR, because if we protect their neck but don't do CPR, they are going to die anyways. CPR for a child and infant. So there's a couple differences. Similarities for adult to child is location. It's the nipple line. It's the same ratio, 30-2 for one rescuer. If there are 2 rescuers, it does drop down to 15-2. But if there's only one, it's 30-2. If the difference is, if you're unwitnessed, so if you don't see them collapse, you want to perform 2 minutes of CPR, so 5 cycles, then call 911. The reason why you do this is most of the time it's caused by asphyxiation, and hopefully you can get that out of their system. You'll still need to call 911, but it's better off for them. If you witness them collapse, if you're alone, go activate 911 and get the AED and then begin CPR, or send someone else just like an adult. The depth that you're going to want to be is 1/3 to 1/2 the depth of the chest. Depending on the size child, you might need to do 1 hand or 2 hands, depending on the size of the child. Infant CPR. The ratios are the same, 30-2 or 15-2. However, and then other similarities, the first 2 minutes for 5 cycles before you call. And the same is 1/3 to 1/2 the depth. You may need only 1 or 2 fingers depending on the size of the infant, and you'll place your mouth over the nose and mouth of the infant. Only puff the air in, not a full breath. Obviously, they have much smaller lungs. If you're not sure the age of the child, if they fit in your arm, they're an infant. If they're not, they're a child. It's the easy way to make shift. So you want to make sure you do that head tilt, chin lift every time you give a breath, and then using 2 fingers to press down into the infant. Heimlich maneuver. So for choking, universal sign of choking, or hands around the throat. You want to ask if they're choking. I know it sounds silly, but ask first. May I help you? If they say, they'll probably nod their head, yes, help me, or leave them alone until they pass out. If they can speak or cough, don't do the Heimlich maneuver. That means they're having enough air. They do need it. Abdominal thrusts. So you want to place yourself behind the victim, and you want to put your leg in between their legs and your other leg backwards in a scissor stance or in a lunge. That way, in case they collapse on you, you don't fall over. You want to place your hand above the navel or belly button in a fist, okay? And then if it's a woman that's pregnant or a very large person, you can go higher, but you want to put it right above the navel if possible. Otherwise, you're going to put it in the center of the chest. You're going to pull up and in a J stroke. Okay, so basically envision you're drawing a J with your fist, or doing like an ice cream scoop stroke. Basically, you're going to pull up and in and continue to do it as forceful as you can. Like you might even pick the victim up off the floor a little bit, depending on the size of the victim, until it comes out or they pass out. If you're unable to do this, allow them to pass out, lower them to the floor, and begin CPR. When you do CPR, it's going to try to force that blockage out of the airway, and also their airway will be relaxed, so there's a large chance it will become released. Infant blockage. So you want to place the infant on your forearm with supporting their head around their jaw with your hand, and do back blows to the upper back, 5 back blows. And then you can flip them over and do 5 chest compressions with 2 fingers and on your forearms. You want to look for the objects and give breath and repeat until you get the object out.